Good day everyone, I am Maria Mariela Jessica P. Ramos, a student nurse from Lyceum of the Philippines University, Batangas. So for today, I will be performing a return demonstration in the assessment of ear. But before we proceed, I will be performing a proper hand hygiene. Don't forget to wear a mask and put PPE if necessary. And also, I already closed the curtain for privacy. After that, we can now proceed to the assessment. So, good day, ma'am. I am Mariela Ramos and I will be your nurse for today. So, for verification po, may I know your name?
Quincy Lina po.
So, how about your age po?
13 po.
So, how about your birthday?
July 19, 2008.
So, single or married?
Single po.
So, what language do you prepare? Tagalog? English?
Tagalog po.
Okay. So, how would you like me to call you po?
Quincy na lang po.
So, okay, Quincy. So, for today, I'm going to examine your ear. So, for the ear, we have different ear procedure. So, I'm going to start with inspecting your ear, followed by palpating the area surrounding your ear. And then, I'm going to use otoscope here. Here, otoscope, to check the internal or the inside of your ear, as well as the tympanic membrane or yung tinatawag nating eardrum. And also after that, I'm going to perform the whisper voice test. This is to check kung meron tayong hearing impairment. Okay, lastly would be the Weber and Rini test. So for Weber test, this is to check the lateralizations or kung sa isang ear lang ba tayo mostly nakakarinig or sa both ears. And then for Rini test, this is to check the air conductions as well as the bone conduction. So basically, the Rini test and Weber test is to check the hearing loss. Could be conductive or sensory neural hearing loss. So in order for me to do that, I'm asking your consent if it is okay to touch the certain parts of your ears. So it's okay to you?
Okay po.
Okay. So don't worry, are the informations and findings is safe and completely confidential between me and the attending physicians that I will be referring. Okay po? Okay. So, but before we start, I'm going to ask you some questions about your current symptoms. Okay. So, do you have recent changes in hearing?
Wala po.
So, ear discharge.
Wala din po.
Ear pain po?
Wala po.
How about ringing or crackling in ears?
Wala din po.
So, for past history naman po, do you have any previous ear or hearing problems?
Wala
Such
po.
as infection,
Wala po.
trauma,
Wala din po.
earaches?
Wala
Okay.
din.
So, sa family niyo naman po, any family history of ear problems or hearing loss?
Wala po.
So, how about lifestyle and health practices po? Do you live or work and around frequent or continuous loud noise?
Hindi po.
Use of ear protections from noise or while in water?
Hindi din po.
Okay. So, has hearing loss affected ability or care for yourself or others?
Hindi din po.
Okay, so let's start na po. But before that, I'm going to perform a proper hand hygiene first and put my gloves on. So now, ma'am, I'm going to inspect and palpate your external ear.
Okay po.
Do you feel any tenderness po?
Wala po.
Okay. Do you feel any pain?
Wala po.
Okay, ma'am. So I observed that your ear is normally equal in size and your auricle is aligned well with the corner of your eyes. Also, the skin smooth in texture and it just the same color of your face and skin which is normal response naman po. So also as I palpate your ear, wala naman po kayong naramdaman na any tenderness and pain. Now I'm going to testing you for the otoscope examinations.
Hindi po.
Okay, so I observed that a small amount of odorless serum is the only discharge that I have seen or present on your ear, which is a normal response naman po. And also, I observed that your tympanic membrane, it's appear pearly gray, shining and translucent. And also, there's no present of retractions or the bulgings. Okay, so now, ma'am, okay, let me just put the otoscope here. So now, ma'am, I'm gonna have you do the Valsalva maneuver. So I'm gonna, I want you to exhale and I'm gonna pinch your nose for in a matter of 10 seconds. Okay. Okay, ma'am, so the result is, ma'am, because you were able to maintain your breath in a matter of 10 seconds. So now, I'm going to testing you for hearing and equilibrium test. Okay, ma'am, in order for me to do that, I'm gonna cover one of your ear and I'm gonna whisper something and I want you to say it loud for me, okay?
Table.
Okay. And
Apple.
okay.
Table.
Okay.
Banana.
Okay, so I observed that your hearing ability is normal because you're able to say the word that I whispered while I covered your one of your ears. Okay, ma'am, for the next part of our assessment is that I'm going to testing you for reading test. And for me to be able to do that, I'm gonna use this assuming turning fork. And by doing that, I'm gonna doing this. And I put this behind your ears. And just tell me to stop if you no longer hear the vibrations. So that I can flip it and test you for air conductions. Okay?
Okay po. Stop.
Okay.
Stop. Stop. Stop.
Okay, so based on my observations, the air conduction is appear longer than the bone conduction, which is the normal response. Alright, the next one I'll be doing is a river test. Do you hear the sound louderly?
Yes po.
So, okay, so I observed that is normal because you able to hear the sounds in your both ears while doing this river test. So, for the last part, I'm going to do robot touch with you. So, can you stand up? Okay, put your feet together and your arms beside you. Okay, close your eyes. So, okay. Don't open your eyes until I say it. Okay. So, Mama, you may sit down. Okay, so I've observed that the result is narrow because you're able to maintain your posture and positions while doing the test. A matter of 20 seconds without falling or swaying. So, do you have any question?
Hello po.
So, if you have any questions or clarification, just state it with the precisions that I'll be referring to. Is that okay with you?
Okay po.
Okay, so thank you so much po.
Thank you din.